The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist. And joining us from Altman Hospital are Chad Gooding, a LSVT-BIG certified physical therapist, and Michelle Summers, an LSVT-LOUD certified speech and language pathologist. Thank you for joining us this morning.
Thank you for having us.
Thanks for having us, Paul and Brad.
People with Parkinson's disease may notice changes or difficulty chewing, eating, speaking, or swallowing at any time, but tend to increase as the disease progresses. Just as Parkinson's disease affects movement in other parts of the body, it also affects the muscles in the face, the mouth, the throat, and the ones that are used for speaking and swallowing. Today we're going to talk about the different types of therapy to help people adjust and maintain speaking abilities and understanding. We'd like to remind our listeners today that the program is also available on our podcast, which can be downloaded from the App Store for your favorite mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, anywhere. If you have questions during today's program, we invite you to post them up on our live Facebook feed, or you can give us a call here today at the radio station at 330-450-1480.
So, let's start with the basics. What is Parkinson's disease?
So, it's a good question. Parkinson's disease is a progressive neurodegenerative disorder, and it affects a certain part of the brain, Paul, called the substantia nigra. And in this part of the brain, there are neurons that produce a chemical called dopamine. Now, when these neurons are attacked, you don't have as much dopamine in your brain, and that's kind of what leads to the symptoms of Parkinson's. It's a disease that is extremely prevalent. It affects 1 million people in the United States and up to 4 to 6 million people worldwide. And, it's growing. There's estimates by 2040 that those numbers will double. So it's a very substantial problem.
Well, why is that happening?
It's a good question. So a lot of it they think is possible. A combination of things. They think it's possible environmental issues. But yeah, they really don't know totally why it's happening.
And I think as we have more information about it, people are recognizing the symptoms. Prior to this, I think some people just ignore it and don't really know what the actual symptoms are. And so now maybe that we know more about that.
Sure.
We're recognizing the symptoms now, and can I identify it?
It's crazy because usually when it's diagnosed, it's diagnosed a little later in the progression of the disease. Yeah, so when they actually, people start noticing these symptoms, the disease has already progressed in the brain a little bit. And that's because the symptoms don't show up until those dopamine levels they have to go to a certain level before you start seeing symptoms.
Yeah. I remember hearing Michael J. Fox say that his pinky finger started twitching.
Yeah, that's usually odd. Yeah, as far as symptoms goes, that's a lot of times the first symptom is a tremor on one side of the body. That tremor will kind of start, and you're thinking, what the heck's going on? Yeah. As you go into the doctor, and then, as the disease progresses, you start to have other symptoms. The other symptoms, I can keep talking on the symptoms if you like.
I guess what I'm thinking here with the next question is, okay, what are the stages of Parkinson's? Are they all the same, or is everybody different?
Yeah. I think they've done the stages into 5 different stages. I think that's how the classification system has worked. So the first stage is, as you mentioned, you start with a tremor on one side of your body. Now, these are variable. Everyone is different. So not everyone are going to have the exact same symptoms or the exact same progression through the disease. But a lot of times it starts stage 1, tremor, one side of your body. You start to notice the lack of facial expression in the face. And then what you do is as the disease progresses, you go to stage 2, and that tremor a lot of times will go bilateral to both the hands. And that starts to affect your balance a little bit. You start to notice that you start walking a little slow. We call that bradykinesia, when you're walking slow, and you also start to notice that your movements get a little smaller. We call that hypokinesia, and that's usually in stage 2. Stage 3 are marked by 2 specific things. One, you start losing your balance and you can fall in stage 3. Also, the slowness of the movements become more prevalent. Stage 4, that's when you really need some help. You're using potentially a walker to get around, you need some help at home for your activities of daily living. And then, in stage 5, your muscles are very rigid in your legs, and it makes it difficult to stand or walk at that point.
Okay, in the last century, when I was in the university, the symptoms were the characteristic pill rolling.
Yes.
Your wrists, okay, and that was the I guess at that time the first symptom, but that's far past.
Yeah, no, that is typically they notice the pill rolling is something that folks notice early on in the disease. Yes.
Okay, so how do we treat this disease?
So,
and I know progress has been made, but how do we treat it?
Sure. So there's usually been a 3-headed approach. It's been with medicine, with deep brain stimulation, and with exercise. So the medicine typically that they prescribe for this is I'm not a physician, but it's Cinemet usually, and that's right up your guys' alley. So. And that's basically to increase the dopamine levels in the brain. The problem with that is eventually you build up a tolerance to this medication. So you got to take more and more and more and more. Yeah. So folks are also, I've had patients also that have gone and had deep brain stimulation where they implant an electrode in your brain, and essentially what I've noticed that does is it actually cuts down their dependency on the Cinemet. So like a patient of mine, they had that done, and like they're taking like 50% less of the Cinemet, which is great because then the Cinemet can last longer. And then the third way we're treating it is with exercise.
And that's newer, that part
that
of
is
it.
Newer.
Yeah, focusing specifically with the physical therapy and then the voice.
Yeah.
The individual themselves, or you physical therapy with them, or what? Help me here.
So newer in the sense that the new research is showing. Now we know like the obvious benefits you get from exercise with Parkinson's. You stretch the trunk muscles, you get the legs stronger. But there's another benefit, and this is really, really cool and really, really great news, is that trials are showing that it can actually slow the progression of the disease. So when you exercise, and you have to exercise a certain way, in an intense way, it can slow the progression of that disease. And they think that happens because you're restoring connections and signaling pathways in the brain, and you're also increasing a reliance on the undamaged systems of your brain to keep moving in certain ways. So intense exercises is they're finding very beneficial. So the push is, and that's what we'll talk about, I'm sure, in a little bit, is the LSVT gets folks exercising early, and that's the key. And
not just regular exercise, it's specific exercises for that.
Yes.
Somebody can just say, hey, I'm just going to really work out. That's not what we're talking about. It is specific exercises. Specific exercises, intense exercises. Have you guys seen that show, American Ninja Warrior? Have you seen that, where they have to go like an obstacle course or whatnot? My kids love it. Isabella and Noah love this show. But what happens in this show is that, or what's cool about this is there's a guy on there that has Parkinson's that's competed in this show. His name is Jimmy Choi. Choi. I hope I'm pronouncing his last name correctly. But he's doing a couple of really cool things by doing this. One, by competing in it, he's showing you what you can do with if you have Parkinson's disease. And two, he's helping himself because that intense exercise is slowing the progression of his disease.
Okay, what's going on with somebody who has Parkinson's disease? Is the neuro system being destroyed, or what is it?
Well,
I guess I'm where I'm trying to get here is, with MS and some of the other diseases, it attacks the coating of the nerves and all that sort of thing, or muscular dystrophy, whatever. What's happening here?
As far as the neuroplasticity, that is what is being reduced, and we're trying to tap into that to keep that going, and that's why it's so important to do this early so you don't lose that neuroplasticity.
Right. With the dopamine levels in the brain being so low, you're having those symptoms of the rigidity and whatnot. I don't know if that's answering your question, but
so the progression of the dopamine issue
correct
is what's causing this. Is that correct?
That is correct. Yes.
And there are no other influences. Yes. No.
And I would say with Parkinson's, it is one of, you can have some overlying other things going on as well. Often, you have Parkinson's, but I would say there's other things that contribute, not just specifically Parkinson's. Oftentimes, I'm trying to think if I could name anything specifically, but it can progress all in of itself, and usually, Parkinson's has other symptoms with the gait and the voice and the swallowing and all of that can
There's
go
a lot
on
of
with it
secondary
too.
issues that come up. You can aspirate, then you get pneumonia, you can fall and then you break your hip, and then, you have the secondary, the comorbidities that come across or that come along with that.
Right.
Okay, what about surgical issues here? Aren't there some neuro sort of operations?
Yeah, and just the deep brain stimulation. But I'm believe me, I'm not an expert on that particular field. But the deep brain stimulation is something that they're doing. That's the only one I'm really familiar with. That I'm sure somebody could educate me a little better on that.
And there's a lot of those that wouldn't qualify for it. First of all, for that, and a lot of people who would be apprehensive about that just because it is a brain surgery for sure. Has done amazing things for sure, but you have to there's certain qualifications for that.
Okay.
All right, so
no reverse here.
No, but here's what's cool. No reverse, but here's what's cool. Normally, a progressive neurodegenerative disorder, today's the best you're going to be, right? So tomorrow, you're not going to be as good as you are today. That's not the case with Parkinson's. With Parkinson's, you can be better tomorrow with exercise, with medicine, than you are today. You can be better in 4 weeks with intense exercise, like our program. So that's something that can give the listener out there with Parkinson's hope. You can be better. It's not like, you can control, how quickly this disease progresses. Okay. And that's really cool. And that's one of the really cool things about this program.
Okay, neat. First break is here. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication and filling a weekly or daily pill reminder? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you're a caregiver or you personally take multiple medications, our revolutionary new pill packet will change how you take medication forever. Instead of multiple pill bottles, you'll receive one easy dispensing box that contains all your medications in individual packets organized by date and time with instructions clearly labeled. It's simple, convenient, safe, and affordable. Call or stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia and find out.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about the latest treatment for Parkinson's disease. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. Sort of started the conversation off camera here about the next question. What exercise, if you have Parkinson's disease, what do we do?
So, traditionally, the way physical therapy has handled this is it's been a very we've taken a reactive approach. So when you've had Parkinson's, if you have fallen, broken your hip, injured your leg, then, you would get a referral, you come to physical therapy, and we would strengthen your leg, and then we would work on your balance, this sort of thing. So with LSVT-BIG, it's a very proactive approach. It's different. It's not reactive, it's proactive. So you get the diagnosis of Parkinson's, and then what we do is, since we know that intense exercise slows the progression of the disease, we start with the program right away. So to answer your question, LSVT-BIG is an offshoot of LSVT-LOUD, which came first, which we'll talk about, but it's an intensive amplitude focused physical or occupational therapy approach that we put you through, a 4-week approach.
Okay. Patient shows up.
Yep.
And maybe they only have tremors on one hand.
Okay.
And you're going to give him physical therapy. What are you going to do?
Yeah, so with this program, we're going to focus on amplitude, size of movement. It's LSVT-BIG for a reason. We are focusing on, because what's happening with this particular individual is his world is getting smaller, his steps are getting smaller, and as a result, he's walking slower. So instead of focusing on the speed of his walking, we're going to focus on the large movements of his walking. What research has shown is that's much more effective in increasing speed, but it also increases accuracy of movement and increases balance. So we are going to focus on getting his movements bigger.
So what are you going to do?
So he's going to come in. It's 4 times a week for 4 weeks. It's an intense program. The first half hour, just to break it down for you, we're going to do 7 exercises. You're going to do these called maximum daily exercises. You're going to do them every single time you come in. We're going to vary them, and we can put weights on you. We can put you on foam to make it a little bit more difficult. But basically, these 7 exercises you do every time. These are the exercises you're also going to do for homework when you're not with me. You're going to do them later that night. That's the first half hour. The second half hour of the program, we do 5 functional tasks. These tasks are identified at your evaluation. Things that you're having difficulty with at home, buttoning your shirt, so on and so forth. We're going to do each of these tasks. We're going to work on them. Then we're going to do something called a hierarchy task. That is something that is also something that you're having difficulty with at home that requires multiple steps. So just a quick example, getting into the shower, sitting on a shower seat. So my one patient had difficulty with that. So they had to negotiate the tub, step over the tub, turn the water on, sit down, get up. We break that down into parts to make it more manageable. And then we always practice our big walking, our big steps at the end of the program. We do this 4 times a week for 4 weeks. It's a total of 16 sessions.
So in the course of that, we want to stabilize this person's gait.
Yes, we want to get it bigger. We want to increase their stride length. So we focus on increase their arm swing when they're walking, because typically what you'll see is that's going to be very small. Their trunk isn't going to rotate. The exercises focus on trunk movements, and these movements all facilitate bigger movements, and they're intense movements. We do them with maximum intensity. So on a 0 to 10 scale, we want you to be a 7 or higher, because we know that's what drives neuroplasticity. That's what slows the disease, the repetition and the intensity of the movement. So that's what kind of differentiates it too from traditional physical therapy. It's intense and it's amplitude focused.
Okay. Very interesting.
Yeah, it's pretty cool.
All right, well, anything else that you want to comment on about, like, goals of LSVT-BIG?
Yeah, so, I mean, the goal is just to get you walking more normally. When you start walking with bigger steps, it feels too big, but to the outside observer, it looks normal. So the more you do it, the more we recalibrate you to keep doing those types of movements. And then before you know it, after 4 weeks, week 3, you start noticing recalibration where you're actually walking without even thinking about it, looking more normal. That's going to increase your balance. That's going to increase your stride length. You're walking, all in all. Yeah.
I think, too, like the caregiver, spouse, or whoever is involved, too, it is so important that they are on board with what we're doing, because they're going to need to be doing that cueing, the big steps, reminding, because the one with Parkinson's doesn't recognize they're taking a small step.
Correct.
So they need the verbal cueing to do that big step.
Does Northeast Ohio experience more Parkinson's disease cases than...
That's a good question.
I would not know.
I would not know that either.
At one time, this was the industrial, whatever, of the country, and it's not so much anymore. I mean, I can remember as a young person, the air was, blue.
Sure.
Yeah, I don't think we have those statistics available, specifically that I know of.
Okay. I agree.
So, what are the fundamentals of LSVT?
The fundamentals, just the 3 basic fundamentals are just 1, amplitude, size of movement, okay? We want you to walk big. The second is it's going to be intense. We want you to walk big, take bigger steps, reach big with a really high intensity of movement, forceful movement. And the third, we're doing both of those because we want to push something called recalibration, or getting your brain to, again, it feels like you're walking big in the beginning, but to make that more normal as you move through.
Okay. Second break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The summer driving season's here, and it's the perfect time to shop the largest auto mall in Northeast Ohio with one click at Kempthorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, and Sprinter, too. Something for everyone's price range. Kempthorne.com makes shopping easy, fun, and friendly. We also have a huge selection of pre-owned vehicles, and less than stellar credit is never a problem. The Kempthorne family name's one you know and trust. Committed to our community for over 80 years. Shop Kempthorne.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of compression socks and hosiery. We carry Jopes, Trueform, Activa, and more. Low compression socks and hosiery are the everyday low price of $7.77. High compression socks and hosieries are $17.77. In-stock hosiery only. These prices are more than half off the regular price, and nobody can touch our prices. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about the latest therapy in Parkinson's disease and other neurological issues. We've got a lot more to cover this morning, so let's get back to the show. And I have to put a commercial in here, so you won't want to miss this upcoming Kiko Absolute auction, June 25th in Norton, with auctioneer Bill Gill Jr. You'll find tractors and equipment, lumber, tools, and a Bally walk-in cooler with compressor, Easy-Go electric golf cart, a 12-inch chain-link fence gates, sailboat sails, wave runner, sailboat sails, a boat and motor, acoustic ceiling tiles, 20-gallon fish tank, and more. Your chance to get back into the fish business. Mark your calendar for Monday, June 25th at 5 p.m. at 2744 Floraway Drive in Norton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information. So, I guess I'm up, huh? Where can I receive LSVT services, and would you repeat what that stands for one more time?
LSVT, it stands for Lee Silverman Voice Treatment. And that comes from Lee Silverman was a lady who had Parkinson's and provided some of the money for the research.
I see.
But, so it started with the voice, and then from there it went into the physical therapy program. But
so
that's what the LSVT...
Was she a physician or just a person like you and me?
Just a person like you and me, from what I understand.
Yeah, that had Parkinson's, yeah.
Okay,
yep.
super.
Mm-hmm. Oh, and where you can receive it. Yes. So, Altman Hospital, Altman Tusk. We have 4 therapists and a speech therapist, Michelle.
Now you're in the building across the street from the hospital?
Yeah, catty corner from the medicine shop, the legendary medicine shop. So we're catty corner from you at Altman Tusk. There's myself and Todd there. He's a physical therapist assistant, and then at Altman West, we have Stacy, who's a physical therapist at Altman West, and an assistant Jody, who have been trained. So the 4 of us have been trained. So we had you covered in Maslin and Canton, and then Michelle, you go to both locations, don't you? I mean, she goes to both, so she goes back and forth.
With the closing of the hospital in Maslin, is that Altman facility kind of ramped up a little bit?
Yeah, totally. Okay. Yeah, very ramped up. Yeah. So they're busy. Mm-hmm. They're busy at West.
Yeah.
So, but they're also busy with LSVT stuff. So, yeah.
Yeah, I've seen a significant increase in the past 2 months.
Yeah.
So, hopefully word's getting out that the program is there.
Sure.
Mm-hmm. Yep.
Sure. So, fun fact, LSVT-BIG is being delivered by over 10,000 certified LSVT clinicians in 38 countries. By the way, when did this come to the forefront, this program? How long has it been in play?
Well, the speech part of it, the speech and voice since 1987. Mm-hmm. And then the physical therapy was
like
2007.
Yeah, you could start getting certified in 07.
Right.
Okay.
Yep.
So it's fairly new, that part of it.
Yeah.
Right.
So.
And like even as a clinician, I had the training 15 years ago, I want to say, but I have to recertify every 2 years. So we're still getting the new research, and they've made changes. In the time that I've been doing it, the program has changed. So that's good. That tells us that they're continuing to do research and seeing what needs to change for the program to be effective.
What about the difference between LSVT-LOUD from LSVT-BIG?
The loud portion affects, we're addressing voice and speech specifically. So the BIG is the physical therapy program. The LOUD is the speech. So it's the speech therapist that is doing that program, looking at voice and speech.
How often are those with Parkinson's disease affected by a change in voice?
89% of those that have Parkinson's will experience some change in voice and speech. So that's a very large percentage. Now, I'm going to say not everybody recognizes that change, nor there will be a huge percentage that don't do anything particularly about it. So, and it is usually a caregiver or spouse that is noticing it first.
Now, the first thing I think of is maybe they need a hearing aid and they can't hear themselves, but those people might be louder. Would that be right? And with Parkinson's, they're getting softer?
Correct.
Okay.
Yeah, and oftentimes those with Parkinson's think it's those around them that have changed, and that it's their hearing that they need to do something about it. So being able to bring them in and educate them on, okay, this is actually your perception of your voice has changed, and that's what we call calibration.
I'm sure that can be an emotional experience and conversation.
Yeah, and it is, and recognizing, hey, something has changed, there's some deficits here, but the big thing again is we can do something about it. And that's what my patients, I can say, this is something you can control. There's a lot of things you can't control. This is something you can control, and change that perception of your voice and not have to repeat yourself. Repeating is huge.
Okay. In Roman literature, the guy, or Aristotle, the guy who
repetition
had a bad voice and was out yelling at the ocean or something. I can't think of the name of the guy, but is that part of this?
As far as clarity,
yeah,
is that what
you're going out in the backyard screaming at the birds or something?
No, and you're not screaming. We are just using a loud voice.
Okay.
So now my coworkers will say that when I am doing this in the speech therapy room,
you can hear
they
it in
can hear it, but it is okay. They know what it is, and it is good. It is good. We don't want people to be self-conscious about that.
So we're basically exercising our vocal cords.
Absolutely.
Okay.
Yeah, we are not screaming. It's controlled, very controlled. And I'm also fine-tuning that quality of the voice. If I'm hearing them doing that prolonged vowel, that's what we're holding. That's part of the exercises. If I'm hearing strain or like it's very breathy, we're going to fine-tune that. It has to change. There's something specifically that we're looking for. So it's not just random yelling.
Certain tones? No? Yes?
Not particularly. I guess it's more... what I'm listening for is good quality, and that's what the research says too, that as a clinician, that's what I'm tuning to, good quality, that there's not a strain, that I can, and the patient feels comfortable doing it too, and that improves as we go too. And what I would be expecting is that they can do this on their own, not just with my cueing.
Is there anything you can speak to of what a session sounds like or looks like, to give us an example for the listeners?
The first half is spent on strengthening tasks. So that is going to mean that we do 15 of these prolonged vowels. Okay, so it's your basic ah at a louder intensity for as long as you can. So 15 of those, and that's one thing that has changed. In the past, we were only doing 10, and since I've recertified, they have increased that, so showing that there's benefit to doing more. So the first task is that. The second one is pitch exercises. So that's, I think a lot of people forget about that. But if you notice, someone with Parkinson's, their voice can become monotone. And that's what we're working against. So the pitch exercises are trying to increase that range. So we're doing high pitches and low pitches to address monotone speech. The third strengthening exercise is a list of 10 sentences that they have written. These are things they say every day at home. What are we having for dinner? Okay. What's the weather like? That's the third task, and we go through those sentences 5 times at a loud level. That's to get them used to using that phrase that they use every day, using that at a louder level that can be understood. The second half an hour, is all on functional tasks, just like Chad said for theirs. But ours is a little bit different, that each 4 days I spend at one level. So it's words and phrases. Then the next 4 sessions are at sentences, the next 4 sessions at paragraph level, and the last 4 sessions are at conversation level. But every time we are looking for a carryover activity, meaning I'll ask, what are you doing tonight? Are you going to dinner? That's when you're going to use your loud voice. So that helps it transfer from my therapy room to outside functional daily tasks, because that's the purpose. It doesn't do any good if it just gets louder in my room. It has to transfer to daily communication.
What about sing-along? Singing. Does that fit anywhere in this?
I never discourage it, but it is not part of the program as far as the research aspect of that. But, singing definitely would not hurt. Helps, with the pitch, that range of pitch, it could help, but it is not part of the program based on what the research says.
Okay.
What about your length of your program? So you mentioned how many visits you have, and I'm thinking about, with respect to Parkinson's and what I believe I know, it seems like in your particular environment it might be wise to have long-term physical therapy for both speech and exercise. So how do you handle that with someone who
there is
goes through the
carryover,
program?
that aspect? We do the 16 intensive sessions, and then I probably do this a little bit differently just because I'm the only one doing that. I do like in a month I call the patient, because the biggest thing is after you complete both of our sessions, physical therapy and speech, you have to continue the exercises or you will lose what you have gained. Now, an interesting fact, though, approximately 80% of patients who maintain the treatment, the recommendations that we've made, the exercise program that we've set up, will maintain the improvement that they've made for 12 to 24 months post. So again, I do an accountability call in like a month, then in 3 months, 6 months, both of us bring the patient back in to reevaluate to make sure they're still at what they were doing, the same levels at what they were doing. If not, we do a refresher course, is something to kind of get them back in gear. But I will say most often when I have a patient who says, I need to come back, I'll say, are you doing your exercises? And they say no. And that's the number one reason. And that's human nature.
It is.
Totally human nature. Yeah.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we are a partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters with the Medicine Center Pharmacy. We've been talking about the latest in therapy for Parkinson's disease. Joining us today are Chad Gooding and Michelle Summers, Altman Hospital therapists. Let's get back to our final segment of the show.
All right, well, for listeners just joining us, why don't we give a thumbnail sketch of LSVT and what your role is at Altman and how people can get into contact with you if they or their loved ones need a little bit more counseling on how to progress with helping patients with Parkinson's.
Yeah. So the first thing you'd want to do is go to your physician, talk to your physician about the symptoms you're having. If you feel that we're a good fit and LSVT-BIG would be a good fit for you, you need a physician's prescription. Then you would call either Altman Tusk or Altman West and schedule an evaluation with myself or Stacy.
And for the speech part, it would be with me, Michelle. And we're at both of those places, so we can do the program at either one of those locations through Altman.
The program itself is a 4-week program. We usually stagger them, though, don't we?
We do. We can do them at the same time, the BIG and the LOUD program, but we have found, believe it or not, that the LOUD, the voice part of it, wears patients out sometimes. Yeah. So doing them back-to-back, we have found, is not always beneficial. So we usually try to stagger them, maybe crossover, maybe about a week, or get the evaluations going. The other thing that has to be done for the LSVT-LOUD portion, they need to be seen by an ear, nose, and throat physician because they need to have the vocal cord function and just overall health looked at. So I need to make sure that there's nothing else that is going on that is making that voice soft, that there's nothing pathologically going on. So once we have that clearance, then we start with the program.
You're talking about a medical issue here.
Yes,
okay.
Right. So we assume it's that, with Parkinson's because that's what the research shows, but just being ethical about it, like we need to make sure there's nothing else going on that could be interfering.
Something, you speak to research, and I have a feeling that when some people hear the words physical therapy, they think, oh dear, I'm going to be working hard. But I think one of the most exciting things for me today to take away is that you said there is documented benefit that you can be better tomorrow or next week or next month if you follow some of the simple prompts that you will teach in your program. So can you touch on that again? Because I think that's something people need to hear and realize that, you get a diagnosis and it's terrifying, whether it's diabetes or Parkinson's, but you can act on something and make it change. So
with Parkinson's, the research is showing that intense, repetitive exercise increases what we call neuroplasticity in the brain and can actually slow the progression of the disease. So in a lot of these disorders that are progressive, tomorrow you're not as good as you're going to be today. With Parkinson's, that's not the case. You have control over the progression of this disease, meaning intense exercise such as the LSVT programs can actually slow the progression of the disease, and this has been studied. So that's super, super exciting if you've been diagnosed with Parkinson's, that you can positively affect your situation, be better tomorrow, be better in 4 weeks, because the program is 4 weeks. And then when you're done with the program, you continue doing the exercises. And we also have a program at Altman West called Delay the Disease that you can continue to do. And
that's kind of more of an accountability. You are definitely doing exercises there, but they gear it to your level, what needs to be done. But there is an accountability aspect that you're continuing to do exercises and that you're being proactive with this.
Yes.
And I would say, with the voice too, I have to remind people, you would go for a walk. The physical aspect is very obvious. Same thing, you have to warm up your voice and strengthen your voice. And this also does, we haven't talked about this, but there's research showing now that it can have a positive effect on swallowing.
I was just going to ask
as well.
Because I was wondering about that.
Yeah, the swallowing. And how that ties together is that the strengthening exercises that we're doing for the vocal cords, it affects the closure that we're having. So that's allowing, that's preventing aspiration is something that is pretty common with those with Parkinson's, just that overall weakness. So we're doing exercises to strengthen the vocal cords, to have good closure at that level, to try to kind of ward that off. But I will be asking those questions in my program and address the swallowing part separately if that does need to be addressed, because a lot of people, I think, ignore that. I'll be asking the questions, are you clearing your throat? Are you coughing when drinking? Things like that. And they're like, yeah. Well, that is something that needs to be addressed, and sometimes it's just minor changes that need to be made, but we want to keep them healthy, obviously, and so the vocal strengthening exercises can affect the swallowing positively. So
the idea of your program is to get them, shall we say, semi back to normal, but it's their job. You sort of release them to their own.
Yeah, there is a set program for both of us. Like, I have a homework sheet. They're doing homework every night that they're seeing me, too.
Okay.
So on a day that they have therapy, they have to practice one more time.
Same.
Yep. And then a day that they don't have therapy, they have 2 times to practice.
Yep, yes. Absolutely.
And then we give them specific exercises that once they're done with the program, they need to continue to do this daily.
Right.
To maintain what they have gained. And I always try to put it, you've spent this time. You've spent 16 hours working on this. You want to maintain this because you have made amazing improvements.
So it's like a surgery. There's a certain release date, and you let them go.
Right.
So is it possible to stay in your program forever?
No, we don't. It is up to the patient to continue what we've taught them.
Okay.
And usually having the support of a caregiver or a spouse, they usually are we encourage them to be involved in our program.
Right.
So they know what we're doing and why.
Okay.
And then they can help.
So for
encourage.
a better word, how many relapses do you get? I mean, they go home, don't do it. Okay, I got to come back, guys. I mean, that
does happen? Yes,
okay.
That does happen. And my number one question is: are you doing the exercises we recommended?
Okay.
And most
the number
often
one,
that
right?
answer, yeah. So if we have the relapse, it's usually because they haven't continued the exercises.
Okay.
So usually we would bring them back in and kind of revamp that exercise program as needed. But then hopefully that inspires them to continue.
Well, ideally, your program is stopping the progression of the disease or the disorder. But it's
slowing it.
Slowing
it.
Yeah.
So, okay, they progress further with the disease.
Right.
Yeah.
And they may need to come back for a tune-up.
We change our goals then.
Okay.
Like for me, I may be such that they need to be able to communicate basic wants and needs. So we're going to work at that level, which might be shorter phrases, not necessarily everything that they're saying. And for you, you would adjust the deficits that they're having in physical therapy, falls or things. We're going to adjust that. And that's what's nice about it, too, because we can adjust it.
Right.
So we're coming up on 2 minutes left in the program. Anything you'd like to add? How do we get in touch with you? Et cetera, et cetera. Okay.
The phone numbers for Altman Tusk would be 330-363-6215. And then the number for West is 330-834-4101. And again, having a doctor's order is what is needed to start the program. And then from there, we will do the evaluation and decide, is this the right program for you? And if not, there's other things we can do as well. Some people are scared away by that intensity. And I always say, let's get the evaluation done.
Right.
We can adjust things if we need to do something differently, but at least take that first step.
Absolutely.
Well, do you suggest we start with you first, or we have our doctor first, or?
I would say whatever your biggest concern is. If it is, and we usually do talk. So
Right.
Chad would say, hey, I do think they would benefit from that program, and the same for me too. And some people have started with me because that's their biggest concern for the speech,
Right.
and others have been, no, it is more my balance and the gait. So
The biggest thing is that go to your doctor, talk to your doctor about the symptom that you're having or the symptoms that you're having, and decide, which one you would like to do first.
Right.
Right.
Well, I would suspect that there's a bunch of denial in this involved here. Yes, no, with the patient?
There's a some, yeah.
Some, but I think they realize they can do something about it, so are wanting to do that.
Absolutely.
Okay, folks. Thank you very much, both of you.
Thank you for
Chad
having
Big,
us.
LSVT-BIG certified physical therapist, and Michelle Summers, a LOUD certified speech and language pathologist from Altman Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again right here next Friday, right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.